Hi, this is Jack Jamieson. I'm presenting on behalf of my colleagues Naomi Yamashita, Daniel A. Epstein, and Yunan Chen, and I'll be discussing the influences of social factors on individuals' decisions about if and how to use a contact tracing app. We're focusing on people residing in Japan. The Japanese government released COCOA, the COVID-19 contact confirming application, in June 2020. This is a contact tracing app built on the Google and Apple exposures notification system. It's generally quite a privacy-focused system, doesn't collect any identifying information or location data. Contact tracing apps like this can be effective for helping to contain the spread of the pandemic. They're more effective when more people use them. However, adoption has generally been fairly low. At the time we wrote the paper, adoption was below 10% in most countries. It's a little higher now, but it's still much lower than most government and public health agency targets. Therefore, it's important to understand why people choose to use or not use contact tracing apps. There's been quite a bit of research about this that's identified many different factors that shape people's decisions to install or use an app. These include perceived effectiveness, ease of use, privacy concerns, and so on. However, there is a gap in knowledge about how these apps fit into people's everyday lives. And as we're asking people to take an individual action to serve a collective goal, we should consider how their social contexts shape decisions to take that kind of action. We investigate this through 3 research questions. First, what factors shape people's attitudes about installing and using a contact tracing app? Second, what sort of personal risks do participants encounter during the pandemic, and how does COCOA relate to these? And third, how do participants navigate the risks that were identified in question 2? We investigated this using a survey as well as follow-up interviews, both conducted in December 2020. We analyzed these using a combination of quantitative and qualitative approaches. Please see the paper for further details about that. In general, our participants had quite positive impressions of COCOA, and almost 54% had COCOA installed, which is well higher than the general population. But even amongst this group, 86% were skeptical that other people would register to COCOA if they were infected with COVID-19. Our first research question investigated factors that were associated with people's adoption decisions. So first, let's focus on whether or not participants had installed COCOA. So the first 2 items in this model show us that people who felt the app would be difficult to install or difficult to use were less likely to have installed it. And the third item shows us that people who knew at least one other person who had COCOA installed were much more likely to have installed it themselves. And this third variable highlights the extent to which social norms are an important driver of adoption for this sort of technology. We measured how people would use the app after it was installed in 2 dimensions. The first was whether or not people would register to the app if they were infected with COVID-19. And here the only association in our model was that people who believed that using COCOA would increase their anxiety were less likely to want to register a positive test result. We also measured how people would respond if they received a notification that they'd been exposed to COVID. This was a factor variable combining their intentions to get a PCR test, to self-isolate at home, and to disclose to others, and so on. Again, the only associated variable was belief that COCOA increases anxiety, which was negatively associated with taking these actions. It's important to note that none of the variables associated with whether or not people would install COCOA were associated with how they would use it in these ways. Because anxiety seemed important in our models, we're going to pay particular attention to it as we investigate risks during the next set of findings. So our research question 2, we drew on our interviews and open-ended survey questions to discuss people's perceived risks during the pandemic. The main risk that people identified was that they did not want others to find out if they were infected or if they received a notification from the app. And this was not a universal concern. Instead, it depended on participants' social and professional contexts. So for example, participant 15 was worried about financial consequences and said, "I'm a little worried about getting a notification because I see in the news that people could lose their job when they disclose to the workplace." And participant 84 was concerned about social stigmatization. So they said that even though the notifications sent through COCOA are supposed to be anonymous, since I live in the countryside, people will immediately identify who I am, and the rumors after infection will be very serious. I'm more afraid of social obliteration than illness. When it came to strategies for managing these risks, people generally wanted more control over the flow of information, deciding when and how to disclose to others. Participant 100 said that whether or not to register their infection with cocoa would depend on their symptoms and affordability at the time of infection. Participant 31 said that they were afraid of people's eyes around them in case they got notifications, so as a result they never opened the app in public places. And participant 37 said that if they became infected, even after they were recovered, they wouldn't actually disclose to their friends because they felt that their friends might be hesitant to meet them if they knew they had been infected in the past. I'll conclude by discussing lessons from these findings, especially for designers. When designing technologies that enlist individuals to contribute to collective goals, it's important to recognize that concerns and perceived risks are extended from people's social contexts. This is particularly relevant with regard to anxiety. Health crises like the pandemic are obviously extremely anxiety-inducing, so designers should try to understand how their interventions may relieve or exacerbate anxiety for people in different situations, and how this affects people's decisions about if and how to use that technology. A second, when it comes to privacy, most contact tracing apps research has focused on government and similar types of top-down surveillance. By contrast, our participants were concerned with privacy in a local, social context. In the paper, we use Nissenbaum's privacy as contextual integrity to unpack this. Specifically, we discuss how flows of information through contact tracing apps should be compatible with people's existing expectations of appropriateness. So, for example, infection was stigmatized in the context we studied, so people were concerned about being viewed as irresponsible if they were exposed to COVID. So an app that makes that visible was seen as a privacy risk. Attending to this could involve limiting disclosure, but it could also involve working to shape disclosures to fit existing norms. Third, individual interventions like contact tracing apps should be accompanied by interventions that target community and society scales. Risks that made people want to hide infection information tended to originate from communities, workplaces, and other larger structures. Therefore, if we want to be sensitive to those types of risks, our interventions should be targeted to include the sources of those risks. So in sum, we unpack some strategies about how to design interventions to serve collective goals while accounting for individuals' lived experiences. And given that those experiences are local, future work should look closely at other contexts as well. This means that there's an opportunity for future research such as meta-analyses to build theory about how attitudes towards contact tracing apps change across time, space, and cultures, especially in a rapidly shifting situation such as the pandemic. Thank you very much.